Very expensive.
Okay, well, I think we'll make a start then, if everyone's ready. Artem's telling me the text ready over there, so thank you everyone for coming. My name is Marsha Thompson, I work for Unite the Union, and we're doing a few fringes here with the Peace of Justice project at Webster's Theatre all week this week for COP26. Just to quickly introduce you to the panel, and then we have Corbyn MP, Islington North, an independent MP at the moment. To my left is Dr. Leslie Robertson from MedAct and Doctors for Extinction Rebellion, with Mochan MSP, and Lorna Robertson, who's on the Unite Health Committee for us. So thank you for joining us all today. It's also going out live stream, so hello to everyone watching online. I won't really take up much time as an introduction in the chair. There's just a couple of things I want to point out. Jim Mowatt, who's the leader of Unite's Environmental Task Force, has unfortunately gone down with COVID, so sends his apologies tonight, and has then given me even more lines to say as an introduction. But thankfully, that means you'll only get one 20-minute speech from Jeremy, and not a 20-minute speech from Jeremy and Jim, and then we can get on to the discussion. I don't obviously need to tell everyone in this room how devastating climate change is and the impact that it's already having. It's having a huge impact on global health and health here in the UK. But last week, the World Health Organization said that climate change is the single biggest health threat facing humanity. And I think we hear a lot about the impact on forest fires and fisheries and all the various devastating impacts that we'll get to if we hit the 1.5 tipping point and each change by each fraction of a degree that we get harder. But we don't often talk about the impact it has on health and people are the most impacted by climate change, whether or not that's Indigenous populations who led the march yesterday in Glasgow, or people here, kids in Glasgow dying of air pollution. But across the UK, we've had 40,000 premature deaths every year, and globally there's 7 million deaths from air pollution, all of which are linked to fossil fuels, which is no surprise to most people in this room. But things that we can do something about, the fossil fuel industry gets $5.9 trillion in subsidies, which is, obviously makes it falsely cheap and artificially cheaper at the expense of our kids and our livelihoods. The pandemic, going on to, the title of this is Climate Change and the Health Impact, and I want to talk a little bit about what the Westminster government are doing to the English NHS, because we've obviously seen the NHS respond as best as it can to the pandemic, and it's also, the pandemic has shown that national solutions to global problems don't work, particularly when your national solutions are done by an inept and corrupt Tory government in Westminster that are more interested in profit for their cronies than actually making a difference to people's lives. We've now seen tens of thousands of unnecessary avoidable deaths in the UK alone, and the transmission of many variants because there wasn't a sufficient global solution. The UK death rate stands at 142k and is again on the rise. The NHS is massively understrained. I'm sure Lorna will go into a bit more about that as well, a bit with underfunding, coping with COVID, but the deliberate privatisation of the NHS over decades now. The NHS Health and Care Bill that the government are bringing back into Westminster Parliament on the 22nd of November seeks to make this even worse. It breaks the NHS up into 42 different parts in England, each one of which will have its own independent board and its own independent budget, which will clearly lead to different decisions, postcode lottery for your health, and a rationing of health care. But most importantly, it's modelled on the American system of health insurance, pricing most people out of, they're already consulting 200 different companies on what to charge for hip operations, knee operations. Most people won't be able to afford it, and the health insurance companies will just be pushing for more of a profit than patient care. We've seen the devastating impact that has in America and other places with most people going bankrupt is because of their health bills. And it's essentially just giving over the NHS to capitalists that want to bleed it, drive to profit and destroy the NHS system as a way of destroying our planet. I just want to pick up a couple of other points. We've been, Unite and Your NHS Needs You and health campaigns together, we've been making these points over the last week. We've had videos from Stephen Fry and David Tennant, so please do have a look at yournhsneedsyou.com and sign our petition. But we had some pushback from people saying it's scaremongering to say that people are going to die if this bill goes through. It's evidently not scaremongering. There are people dying at the moment because of the decisions of austerity and the health and campaign privatisation already. This is going to get even worse. In fact, UN Secretary General Antonio Guterres also said we need to be careful about digging our own graves on climate change and the health impact. So it isn't scaremongering to say that the selling off of the English NHS will lead to premature deaths, and people across the UK will die due to their delayed or denied care. We must, as you know, words are cheap, action is needed right now, as I think most people here would agree again. We've got to do everything possible to avoid the 1.5 degree tipping point. In fact, if we get to 1.5 or even 2%, then you have 200 million more people globally that won't have access to water, and the impact that has on global health systems. The NHS is obviously the jewel in the crown, as people will all often say. Niamh Evans often quoted for saying we'll all fight for it with every breath in our body. But what we now have to be doing is making sure that the global solutions for NHS are rolled out to other countries, not destroying ours and modelling on the one in America. We should be saying to other people what you need is actually a publicly provided healthcare system in your country and nation. So just coming back to Unite then, Unite and other organisations obviously have a clear role in trying to impact on the 1.5% and lowering that, in pushing policies through workplaces and manufacturing, putting political pressure on governments and the UK government, as well as governments here in Scotland and Wales and Ireland, but also putting on events like this, which provide a place where people across the labour and trade union movement can come together and demand global action for global healthcare systems that provide for the many. So that's pretty much it from me. I do want to get to the speakers and get to a lot of discussion amongst the people. So thanks to everyone for coming, and I've introduced Dr. Leslie from Medact and Doctors for Extinction Rebellion.
Thank you very much. It's very nice to be here. Thank you for inviting me. I'm a retired GP. I was a GP in the south of Scotland. Before that, I worked in London. I was a GP in Hackney in the 1980s when I saw what deprivation does to health. I became interested in the social health determinants of healthcare and worked in public health for a bit, but then realised I missed people's stories, and so I came back into general practice, because as we all know, listening to one individual person's story helps illuminate an issue. And when you hear the story of people who are suffering poverty, degradation, which in this country and internationally, particularly in the global south, it makes you realise exactly how we have to all engage in this struggle. Medact is an organisation of health professionals who are working for climate and social justice, making the links between disarmament, environment, economic justice and employment, good jobs for all. We have a Health for a Green New Deal group, which Rob Abrams here has been very involved setting up, and we have been engaging with people throughout the UK, and at the march of 100,000 people through the streets of Glasgow on Saturday, the biggest march that Glasgow has ever seen. We were completely delighted to see about 200 young, at least 200, mainly young health professionals, nurses, medical students, saying this is an issue of health justice and climate justice. We're also pleased to know that the BMA, the British Medical Association, which is one of the doctors' unions, at the last annual general meeting a couple of months ago, passed a motion to campaign for the UK to become zero carbon by 2030, including the elimination of fossil fuel use by the NHS. So our union, the BMA, is making progress in that department, which is good. Health professionals' role in the climate justice is fundamental. In my opinion, and in the opinion of my colleagues in Medact, the role of health professionals is not just to talk to and try to improve the health of the person sitting in front of you, it's to try and improve the health of their families, their communities, and their planets. It's all interconnected. We are engaged with planetary health, and it's becoming increasingly crucial that we all do engage with planetary health. The lessons to be learned from Marsha talked about the COVID crisis, and there are many lessons to be learned from the responses to the COVID crisis to apply to the climate crisis, and that prevention is better than cure, that neither COVID nor climate respect national boundaries. This has to be a global international effort, and that the most vulnerable in our communities suffer most from COVID and also from climate. We're not none of us are safe until we're all safe. And that's very much the message that we are putting across. In about 30 years ago, doctors decided that smoking, based on the epidemiological evidence linking smoking with lung cancer, that smoking was not a socially responsible thing to do. They became involved, they became politically active, and smoking is now seen as being something that's irresponsible to individuals and not to society. We need to be doing the same thing with fossil fuels. In 20 years' time, we need to be able to look back and say, why were we using them? They killed people in our communities in the north, their effect were even more detrimental to people suffering in the global south. So health professionals are on board with this struggle. We're distributing here at the COP, we're distributing prescriptions for the climate crisis, asking people to send these postcards to their MPs, to their MSPs, saying, we need a daily dose of climate action, and we need our politicians to inject urgency into the struggle against the climate crisis. So thank you very much, and I look forward to our discussion.
Thanks, Leslie. So next up we have Lorna Robertson, who's the Unite Health representative. Thank you.
I'm just going to, I've written a speech here, and I think a lot of it's been said already about kind of what healthcare workers' role and part of this is, but I was doing a bit of research last week and came up with quite a few startling statistics, so I've included them in my speech. Global, national, regional and local, the healthcare challenges and solutions are similar, recognisable and overlap. There are, however, huge differences in prescribing and testing, especially when you compare America to other countries and the access to ventilators in some of the countries, as we saw during the pandemic. Around 25% of NHS carbon emissions are from medicines. To reduce these, we must reduce unnecessary prescribing and for asthma, change from metered dose inhalers to lower carbon inhalers. The healthcare sector generates 4.6% of global emissions. And something as simple as switching metered dose inhalers to cheaper dry powder inhalers can shrink the carbon footprint while cutting drug costs. One study suggests that 5 doses of a metered dose inhaler could generate the carbon equivalent of a 9-mile car trip. Changing metered dose to dry powder inhalers could, for the patient, save the same CO2 as installing wall insulation at home, recycling or cutting out meat. And hospital meals could be adjusted too, maybe meat 3 days in hospital meals. This and prescribing changes have made globally could make a huge impact. The World Health Organization gave a list of 13 global health challenges, and number 1 is climate change. Extreme weather events exacerbating malnutrition and fueling the spread of infectious diseases. If we look back to the Australian bushfires in 2019, about half the Australian population was exposed to hazardous fumes or pollution levels at some point over that summer. The relationship of health and the environment was shown through the climate lens of devastating drought, water shortages, and then wildfires, and then air pollution. Climate-induced migration is a reality, whereas healthcare can be very fixed. Hospitals, clinic, specialist centres are bricks and mortar. Healthcare is not fluid in most countries. Health systems need to be more responsive to emerging population needs and also movement of people due to climate effects. Where population resettlement takes place, like a humanitarian type relief, health systems must be available. We must build resilience and sustainability into healthcare systems using a climate lens, whether that's planning for disruption of medication supplies, or as we saw when China went into lockdown, the utter reliance on single country production and transportation. Going back to the World Health Organization's global health challenges, it's a fact that the same emissions that pollute our air, causing global warming, also cause 1/4 of deaths from heart attack, stroke, lung cancer and COPD. And number 3 in the WHO challenges is healthcare equality. For socio-economic gaps, there is an 18+ year life expectancy difference between rich and poor countries. And if you add into that the fact the poorer you are, the harder you'll be affected by climate change, that gap will widen. But bringing us back to healthcare locally and nationally, The Scottish Government is building 9 national treatment centres to tackle waiting times. In Tayside, my own ward, this is to be built in Perth, in my own hospital. The building I work in is to be demolished next year to make way for this new building if it's approved. This will be for day case surgeries for Tayside, where you'll see Angus, Dundee, North East Fife and Perthshire patients all having to travel to Perth for their surgeries, and so will the surgeons. Transport links to Perth, especially by bus, are bad, and ScotRail timetable plans will further deplete travelling to Perth, hacking through already infrequent services. I should know how to get up at the crack of dawn to get here to Glasgow today. Near me video and telephone consultations brought in during COVID have worked for some, and have cut patient journeys. But the timetable of these national treatment centres is such that the Scottish Government are looking to recruit from abroad for quite a lot of the additional staff that are needed. We must ask ourselves, is this ethically how we want to workforce plan, by poaching trained staff and causing shortages elsewhere? Where I recycle at home as much as I can, it is only in the last month that we got notice from my own health board that we will be issued with new bins at work for recycling. They're not here yet, and it's shocking that in 2021, huge hospitals like the ones I work in do not have general recycling for staff and health students. The Academy of Medicine, Royal Colleges and faculties in Scotland is concerned about wastage in the NHS, whether it's medicines, single-use PPE, plastic drinking cups and blood collection tubes, the list goes on. But there's so much more we could do better in health, from procurement to prescribing. As a Unite Health Committee, we can make demands nationally, and as health workers have the conversations to force change locally. But everywhere it must be top of the agenda.
Thanks, Lorna. Kevin?
Thanks very much. Thanks to everyone. It's really nice to be here amongst friends, healthcare workers, socialists, trade unionists, and really all of us united in our disgust at governments home and abroad, who see our future, our very existence, as completely expendable. And I think it should say over this weekend, we have seen that unless we, the people, the workers, the communities across the globe fight, the chances of change, certainly of meaningful change, is very remote. And so in the context of today's discussion, the fight for global access to healthcare systems, indeed the fight to keep particularly poorer communities healthy, is a fight that we all know is around climate justice. And that governments sort of throw odd bits of cash at green reforms to keep people happy. But we all know that the reality is, under the capitalist system we live in, and the goal of living for those people is growth, growth and more growth. And if we outgrow the planet, if the populations are devastated by poverty, pollution or little access to health care, the feeling is, well, so be it. They will have wealth in the meantime. Now, I won't speak for too long, I promise, but I think over the weekend and in rooms like this, we have to harness the energy that people have. And Friday I spoke at the People's Assembly, and the ideas that we had around economics and inequality. And really the theme there was that we cannot shut up about this, we need to speak out about it. And the march on Saturday, on Friday, the younger people, I know many of you were there because I see friendly faces to that. So it is incredible to me that in a week that we've been doing all these things, we've been out there, we've been active, that governments allow themselves to be fobbed off by super rich people like Jeff Bezos, who think they can dodge billions in tax and then throw a small offering and it's enough. And I think we have to remember that companies who ask workers to urinate in bottles and work long, exhausted hours for poverty pay is not really the model we would want to base the rest of our society on. And so why would governments think that these promises are for real? I think we need to say, let's not be tricked by this nonsense. and say that actually the public are smarter than that, and we know what is going on. So if we're going to get serious about the crisis, we have to put an end to global corporations thinking that they can just dictate to everybody. In actual fact, and I mentioned this on Friday, all the technology that the likes of Amazon spawn from, it starts from public money, and we invest in these ideas, and so it is the people who should reap the rewards of this, not wealth, for the already super rich. It is actually frankly disgusting. And it gives you little hope to leave the current governments, trusted with what is going to happen. I think it's fair to say most of us here are fortunate enough to live in a part of the world where the worst effects of climate change are mostly far from fatal, although all of us were lucky enough to see some of the Indigenous people out marching with us at the weekend. But I think we can see that largely it feels like those communities are being ignored, when in actual fact it is life or death for those communities. And so we need to continue to fight to support not only people in our own country, but we have a great responsibility to fight for those across the globe. I said on Friday, and I say again, and I think we need to say it often, that climate crisis is a crisis caused by capitalism, and it is made worse by capitalism every single day. And if we want to fix it, we need to end the pursuit of endless growth, and we need to stop serving the needs of billionaires and start serving the needs of our local communities and of people across the world. In Scotland and in Scottish politics, we need to be more honest and accept that we are part of the Western world's love affair with capitalism, and that we are not better than some other places, because sometimes the government here indicate that we're a bit better than England. And if we're absolutely honest, Boris Johnson, is that really a bar that we want to measure ourselves against? It's a pretty low bar, so being a bit better than Boris Johnson is not the answer to global change and to indeed serving the health needs of people. I'm going to finish by saying that I think, I want to say that in 2017 and 2019, I think we did have a chance of having a proper go at coming up with some solutions for the way in which we run our government. And we had genuine ideas for a green revolution. It was a serious attempt to try and change things, and I, for one, was glad to be a part of that. We didn't win that war, but I was glad to be a part of that, and I'm keen to defend those ideas and keep them going. The Labour Party and other parties who see themselves as wanting to fix the climate catastrophe need to work together, but we need to have some clear objectives and clear ideas about how we actually fight global capitalism. In terms of, shouting out and speaking about other countries and pointing the finger at China and Brazil, and saying you must do better, we must do better. We must get our own house in order. And if we really want to change things so that my kids and their kids don't have to worry about which country and which people are going to disappear under the waves, then we have to be serious now. Thank you very much.
Thanks, Carol. And then just before I open it up to the floor, we've got one last speaker, Corbyn.
Thank you, Marsha, and thank you to Unite for organising this event today. I will be brief, so there's time for questions and discussion. I think it's brilliant that there's so many events going on like this, focusing on different aspects of the environmental crisis we're in the midst of. I've just spent this morning visiting refuse workers on strike across the city, and they have a very strong case. They've been very badly treated, and they deserve proper treatment, proper pay, and respect. Because if you think about it, refuse workers, street cleaners are part of a health system that tries to provide us with a safe, clean and secure society. And the events of the past 18 months, 2 years of the COVID crisis has shown us just how dangerous to the health of the people of the whole world are when a pandemic takes place. The World Health Organization warned of this in January 2020, declared it a pandemic shortly after that, and it took several months for Boris Johnson to even understand what a pandemic was, and then eventually to do something about it. Too late. Many lives were lost as a result of that. But go backwards a bit to the statements made by the World Health Organization in 2019, 18, 17, 16, 15, going way back, because they had contended with the Ebola crisis, with the earlier SARS crisis, and many others, and made the point that unless there is comprehensive, affordable, free healthcare all across the world, then everybody is vulnerable to pandemics in the future. It is about the globalization of our demand for free healthcare for all. And all of that is actually possible. But we have a world trade system that is blatantly unfair. We have massive income inequalities between countries, and we have a aid system and a World Bank system and an IMF system that doesn't prioritize free healthcare. Instead, it allows, and in some cases even enables, either an insurance-based or privatized health system to be developed in very poor countries, which of course only benefits the wealthiest people in those communities that can actually buy their way into healthcare. The other thing the corona crisis has shown us is the power and abilities that we have in the world to research new medicines, to research the vaccines, and actually do it quite quickly. And Big Pharma has developed a series of vaccines. We all know the names of them: Pfizer, AstraZeneca, etc. Every single one of those vaccine developments was done with a huge amount of public investment in it. We paid for that research. We paid for those developments. All of the patents are then held by big pharma companies, the ones developed in the US and Europe, and will be then sold eventually to be developed in other parts of the world. If ever there was a time to challenge the obscenity of medicine patents being owned and overpriced sold to the poorest countries in the world, it's got to be now. South Africa challenged them on antiretrovirals and eventually won through generic medicines. And so, if I'd be allowed to quote from the 2019 manifesto, I made the point in that our NHS was being fleeced by big pharma. Therefore, I propose that a Labour government should establish a generic medicines company to manufacture a whole range of generic medicines, which would be then sold at cost to the National Health Service, thus removing this massive profit-taking by those companies. And that, to me, is as relevant today as it ever was when we wrote that. Last couple of things I'd say, so we've got time for discussion, is that our NHS, at the moment, particularly in England, but Scotland is not immune, Wales is not immune, Northern Ireland is not immune, is from the ravages of the predatory actions of US healthcare companies. They've been taking over GP practices in quite large numbers, even in my own constituency, where they're making a large amount of money out of it, and using the popular badge of the NHS, hiding behind it in order to make a big profit out of the NHS. We need a real National Health Service, free at the point of use, totally publicly owned, all employees publicly employed, and accountable to the public for what it does. And if I may say so, we need, in parallel to that, a national care service alongside it on exactly those same principles. Because if we don't have that, then obviously health inequalities will get worse as money is made from those that can afford to pay for expensive medicines or whatever other expensive treatment is around. And so the issues that we face are also public health issues. Air pollution is a major factor. The life expectancy of people here in this city in Glasgow is considerably less than people in the rest of Scotland and considerably less than the wealthier parts of the southeast of England. Air pollution is a killer. It's a killer of people in Glasgow. It's a killer of children in London. It's a killer by tens of thousands of people in big cities like New Delhi or some of the African megacities where air quality is appalling. Likewise, water pollution and water quality are real issues, and the pollution that is thrown into our rivers and then into our seas is part of it. Again, come back to the question of ownership and control and accountability. Privatised water companies in England made 400,000 sewage discharges last year into English rivers. Now, you might say, okay, well, that's over the border, that's in England. Well, actually, you know what? The sea joins everybody up. Anybody that pollutes a river, that pollutes the sea, is actually polluting the whole world. We've got to think in those terms. And so the profits that have been made by privatised water companies have led directly to the pollution of our rivers, the pollution of our seas, and the loss of marine life. And pollution also, of course, affects fish and the quality of fish that people eat. And so it is also about health inequalities within our society. The Green Industrial Revolution concept was a concept and is a concept about changing the way our industries work, not by threatening the jobs of those that work in industries that currently pollute, not by threatening the jobs of every truck driver because they're driving a diesel truck. It's by investing in change and protecting those jobs along the way. The private sector, free market capitalism will never do that and cannot do that because their interest is in making a short-term profit. Our interest as people, as a public, as a community, is about investing for the future and the future of jobs for all. Now, this isn't for today's debate, but it brings into question the whole issues of consumption and the need for a basic income to be provided for our entire communities, a way of reducing the ever-present demand for more consumption, which free market capitalism brings. So a green industrial revolution is not just about industries, it's also about healthcare, it's also about agriculture, it's also about environment. It's a concept, it's a mindset. Do we work with the natural world and with the environment, or do we think ourselves above it and wantonly destroy it, knowing at the same time we're actually destroying our own livelihood at the same time? So there's a lot to think about, and maybe lots of greenwash is going to come out from the big building down the road, and no doubt all those lobbyists from the fossil fuel industry will help that greenwash to come out. I think the real debates are in halls like this, and we will make that difference with our campaigning, communities, trade unions, people, professionals. That's what's going to make the difference. Thank you very much.
Great, thanks. Just before I open it up to the floor, it would be remiss of me not to mention Unite's Environmental Charter and Unite's Environmental Quarterly magazines, but they are sort of 80 to 100 pages long, so we decided that we would have them on here as PDF. So if anybody wants one, then I'll sort of send it to you afterwards rather than printing a load, which would obviously be against the sorts of why we're here. So who wants the first question? I know that Joanna has. So I'll take sort of three and then we'll come back and so one there, and Tommy, did you want one as well? That 1, 2, 3, and Neil, go for it.
Hi, I'm Isabella, I'm a journalist from Portugal. It's a very vulnerable country about the impact of climate change. I would like to know if you think about how the research globally can be done so that this subject comes on more to the general public, because it's not yet there in the communication, in the press, in the media. It's not yet. And how do you think you can make this to join efforts globally in research without ONS or the IPCC reports? With this kind of groups?
Okay, thank you. Neil?
Yeah, just on the core industry sustain the community for centuries, the last few centuries. Now, obviously, with that change, we left the legacy of industrial illness and disadvantage in the community. But what we do now is that the legacy of the coal industry has left us holes in the ground for people to build landfill, build pumping vehicles, something that way. Always now we manage to recycle. And then we move on to the renewable energy field where we have all of these companies that, at one point it was 8 one generation companies came in to install turbines. And that sounds good, and it is good. All of these were privately owned, some of them one of them by an Austrian Viscount, most of them by venture capital, and the community gets crumbs and community benefit from that. So we become a village, a town, an area that has been historically about extracting as much from the ground as possible, and the community left behind, to now take advantage of wind and renewables with the community left behind as well. So my argument is that we should not be ownership, they should be run by the authorities, the Forestry Commission, all these different organisations. But most of all, should run the community so that the profit was in to improve in housing, to improve in people's health and well-being. I hope we will do that.
Was there another hand on this side, or was I just inventing Tommy wanting a question? Do you want to go back to those two? Go, well, yeah, go on then.
And 19 manifestos today, the water companies and anyone back into public ownership. What can you do to ensure that the water party continues to commit to that policy going forward?
Okay. You want to go first?
I'll respond particularly to the first question from Portuguese journalist. There are some very hopeful signs for this links between climate and health being distributed worldwide. The Lancet, which is an international medical journal, has produced a countdown for health. Now, it's not happy reading, but if anybody wants any information about the epidemiology and the facts linking climate and health, they are in here. They've just produced the third update, which is even more depressing. But as people know, the Lancet is an international journal. Health professionals over the world are really taking this on board. I had a pass through MedAct. I had a pass last week as an observer in the blue zone, and for the first time, the WHO hadn't been in. Now, that does seem extraordinary. In previous COPs, there hasn't been a health presence, but this year there was the WHO with fascinating presentations from people engaged in health projects all around the world. It is beginning, and the hope is that by subsequent conferences there will be more of a health presence. Health for a Green New Deal, the campaign I mentioned before, links a lot of these issues, because what we're aiming to do is to decarbonise the UK to net zero energy, to ensure transition is globally just, acknowledging the climate debt historically of the UK. We have the fourth highest climate debt of any country in the world. Create millions of green jobs, transform the economy, and protect and restore, as Jeremy said, ecosystems and also sustainable food systems where food isn't seen as a commodity, it's seen as a human right. So I think there is hope. I mean, in the blue zone, as we all know, there was huge commercial interest. Saudi Arabia was there saying that the problem isn't health, it isn't oil, it's emissions, and we have the technology to deal with emissions, so it's not a problem. So a huge amount of greenwash, but there are also, and I think this is really important, to say this, there were also some seeds of hope that it is being seen as the climate emergency is being seen as a health emergency, a jobs emergency, and an opportunity to transform the economy.
I'll take Lorna next. Thanks, Leslie.
I think a part of Neil's question was about industrial injury, and for me, I think a lot of what's going on is around long COVID as well. I think the lack of RIDDOR reporting for industrial injuries, and also at the beginning of the pandemic, lack of testing to actually register yourself as having long COVID. You have to have had a positive test. And as we know, in the first few months of the pandemic, nobody was being tested. That wasn't being rolled out. So if you caught COVID at that time, how do you prove then that you have long COVID, and that is classed as an industrial injury? So for me, I think the fact that certainly I know people from my workplace who've clearly caught COVID at work because we were in lockdown at the time. They weren't doing anything else other than going to work. But these, and we've got construction sites as well where it was absolutely rife, but we have no RIDDOR reporting. There's hardly anybody has registered this is an industrial injury, and they just weren't interested in actually accepting those registrations for COVID. So I think that is something that's going to come back, and whether the fight isn't retrospectively, and that's obviously a part of Unite as well, is going to have to fight for its members to get this long-term recognition for people who can't work at the moment. Because long COVID, again, is how, as a health service, do we actually staff these clinics as well? The range of symptoms that people have for long COVID can change from week to week. So you could have a respiratory consultant, you could have neurologists and things, but how do you staff a long COVID clinic? So all these things are quite fluid at the moment, but I think that we're absolutely chasing the tail of that as an industrial injury. I think it's something that we have to work hard and fight for, that kind of recognition now for people that are suffering from long COVID.
Yeah, just quickly, I totally agree about the link for sort of, the global approach to that. And I think I was thinking myself, the more doctors and medics and healthcare professionals who bring out information about that, the more likely we are to get people to take it seriously and listen. So that is a really important point that you made. I want to obviously particularly come in on Neil's point around mining and the coal mines. I grew up in a mining area and have spent most of my adult life there, and the devastation of these communities is absolutely to this day unacceptable. There was no just transition at all, and so we absolutely need to learn from that. But very importantly, Neil's point around the wind turbines, that this has happened hugely in the communities that I represent, where companies have come in, and what they do is they offer little things, like they buy all the schools football kits, and communities believe that to be all that they can afford, and it's absolutely not. And it's only recently that I think that community activists have become aware that actually that is not community payback, that is just giving us the ends of what they don't want, and they don't want us to investigate that. So it's been a really important thing in our communities, and I'm sure in other communities, to speak to people and say, actually, this is your energy, and it's about you taking that back and getting what you deserve for the disruptions and the things that happen in your communities. But also there's some good examples in Scotland, particularly in North Ayrshire Council, where they're looking at public ownership. It's very small at the moment, but it's fantastic work going on in North Ayrshire Council around that, and cooperative styles of wind and solar power. So I think there is hope there, but it is about these companies don't want these messages out there, and so we need to fight to get those messages out there, that there is another way of doing this that benefits us all. So it's very important that we push with that. And on Tommy's point about the public ownership of all the water energy, we just need to again make sure that the people in this room are standing up and shouting, because I do believe the public think these things should be in public ownership, and we need to get that message that it's not just us, that it is the public that believe that these things should be working for the people, not for the companies.
Thanks, Carol. I mean, just before I bring Jeremy back, just on that last point, I mean, that's absolutely right. I think even in the tail end of Jeremy's leadership of the Labour Party, we had lots of polling that said the public were in favour of all the utilities. And we've seen the stuff with the gas companies and being a Ponzi scheme over the last little while, with the Conservative government now talking about nationalising one of the big 6 energy companies, but nationalising it for a period of time before selling it out for profit again. And I think just to go back to comments from Portugal's question, and it's on us to get part of that amplification out there. It's on the stories that Leslie mentioned. We're seeing the impact of floods in Scotland at the moment, in the stuff in the water, and we need to really get that. In the same way with the NHS, we need to get these personal stories out of people that are already being denied care. One of the large CCJs in England last week decided to put a target on its GPs of reducing referrals to A&E by 65% and paying GPs that refuse to send people to A&E. And that's the kind of ethos that's what's happening at the moment. We've got many doctors now pointing us and giving us examples of people that died because of their lack of care. And we've got lots of examples around climate change. But then there's so much going on that people almost in this, it kind of goes back to, the media ownership and everyone else. People just are scared to believe this. They genuinely know it's not actually going to happen to us, but it's starting to happen to us. And I think the more we can work together in getting these things out. We have a Fire Brigade Union event in here this afternoon that's talking about how they're the ones that are reliant on to go and put out the forest fires and deal with the floods, and getting their kind of first-hand stories of how it impacts, and getting all of us then to share those out to the public is a good way of application. For Jeremy.
And don't forget broadband communism. Just one quick point, if I could just throw it into the debate following your answer, is on food supply and food quality. There isn't a food supply shortage in Britain as such. There is a massive food inequality in Britain. Hence, we now have more food banks than we do branches of McDonald's across the whole of the UK. And you doubting my words?
No. I'm wondering why we wanted more branches of McDonald's.
Well, it's all right. I'm not advocating more branches of McDonald's to catch up with the food banks. It's all right. But it does show the levels of food inequality. Now, I guess pretty well everyone in this room helps with a food bank or food cart and so on. Sometimes I'm worried about the quality of food that is provided at those food banks and the long-term effect on those families that are receiving support from those food banks, which then leads me on to the question of the quality of food. Now, I'm a vegetarian. I like to eat good quality fruit, vegetables, bread, and so on. We all do. But it's a question of affordability. For the majority of the population, there isn't a choice. They're going to buy the cheapest cuts, the cheapest bread, the most processed food, etc. And they're going to take their kids to McDonald's because it's a way of taking the kids out, and it's a way of giving them a bit of entertainment, and it's relatively cheap. But the quality in lots of places is not very good. And so the green industrial revolution is also about agriculture, food supply, and food equality. And so I want us to also, in our discussions, address that whole issue of the quality of food that people get. We've run campaigns, many of us, to improve school meals. Well done all those that took part in those campaigns. Well done Marcus Rashford for everything that he did on this, and many others. But we've got to go a lot further, because malnutrition, foul air, polluted water, housing stress, stress at work, what does that add up to? A very short life expectancy. And that is the whole issue about our approach to society as a whole, which is an overall collective health issue.
If I could just add to that, I can totally agree with what you're saying, Jeremy. I think if we look at it internationally as well, there is enough food in the world. There is no food shortage. It's just that it's not distributed as it could and should be.
And a great deal of it is wasted as well.
Okay, don't think there was any other hands up, so we're in a old map on it. There's always one.
There's always one, isn't there?
We almost like started an event and finished an event on time. Just almost.
Just on behalf of the communication officer, you're right, and I endorse the market for that community. Just to get out of the way. No, there's another issue which is something again. It's psychological health and political deal with power or a sense of powerlessness. Because one of the things that food banks is, we've become necessary, it should become necessary, necessary for people run by good people doing the best for the community. But no matter how good, no matter how kind those people are, what the signal that's sending to the families that go to particularly with the kids, they're thinking this is what the world thinks of them. They're thinking this is as good as it gets. They're thinking the government doesn't have an arm around them. They're thinking that the best we can expect from the companies operating in the area comes from the table here, but the sponsorship of the local football team or a wee donation and a wee box in the supermarket corner. And that wasn't good enough. It's not just a shortage of a maldistribution of food in the world, it's obviously a maldistribution of wealth. But power, I hate that. Who owns things matters. That's the core of that. So when we hear about companies coming in and putting up a wind turbine, they're no better than the coal companies that were exploiting those people in the past, as they exploited my family in the past. Exactly the same people. It's quite often literally the same values. And we need to change who owns that. And we need to encourage people, I guess. You can't wait for these companies just to say, hands up, it's time for wholesale change, we're going to give you the world back. That's not going to happen. It's going to have to come from the working class organisations and organising. Encourage people to believe that we can change things, we can change the world. It happened before and it can happen again, and it wasn't going this time to make mistake because of the risk. That's the thing. I just want to get off the chest.
Inspired Terry.
Well, just to take it forward with a message of hope from this week, somebody, probably Jeremy, but I might be wrong, I've been to too many meetings already, spoke about the refuge strike in Glasgow. And since I've been here last Thursday, I've been hearing more and more stories from those picket lines. It started with Greta sending a message of solidarity to the dispute from outside Glasgow, and that took the workers by surprise. What's this climate activist doing talking to us? Environmentalists went to the picket line, and at first people were like, well, this is quite interesting, but what's it got to do with us? But then, when the marches came past the picket line and stopped and clapped, people felt a real visceral sense of solidarity. They felt, and they recognised as well, that it was their kids, or people very like their kids, on the march on Friday. And I think the feeling of solidarity and also the whole thing about the next generation, because one of the things the miners' strike did, and the defeat of that strike, was took away that hope of those communities. It wasn't just what's happening to us, it's what was happening to our kids and our kids' kids, and all of that. And so I think there have been important messages of solidarity. Just one tiny thing on food banks. Food banks don't have to be about charity. We organise food banks and charities involved in this through mutual aid, saying, you need something now, I could need something tomorrow. It's not, it doesn't have to be about, charity in that patronising middle class sense. It can be the sort of solidarity we go around the miners' strikes when we organise those sections. That's the message we have to have in all our schools. Could we need more, whether it's floods, redundancy, or whatever?
And particularly if the health and care bill gets passed in England, when it doesn't matter how much of a pay rise trade unions negotiate for you or what terms and conditions you're on at work, you get a health bill and you're screwed because no one can afford it, no one can get any access to health or food. And the other thing to mention, just while we're talking about food banks, obviously the Right to Food campaign and the great work that Ian Byrne and some councils have done by publishing motions on Right to Food. But I agree completely with Terry about mutual aid stuff, but it has become overly normalised. My food bank that is the road to my mum's, which is in one of the most poor areas in London, on a Monday, Wednesday and Friday has 400 people in the queue the entire time it's open for that 3 hours, and it's a continuous line, and that, you know, they're kids that they take out. It's, yes, I completely agree, Matt, that at some point they would, at the beginning it was like, oh my God, the people just leave us, but now that's their normal week. On Monday and Wednesday and Friday we go and get the food from the food bank, and we do need to tackle the normalisation of that as well. Jeremy, to come back.
Just very, very quickly on this. The way out of any crisis is actually collective, not charity, not individual. Think of what working class communities did way back, 17th, 18th, 19th century. Mutual aid, cooperatives, empowerment, and that gives the community power as a whole. And so I hope that the thousands of food banks we have now across the country will turn themselves into food co-ops. And so that gives them a power and gives the users of them, the members of it, a choice of to what they eat, what they buy, how it's run. And that in turn leads to bringing people together in that sense of empowerment. That has to be what it's really all about. And I think that the work that's been done on the food campaign is absolutely brilliant. I've been with Ian and his friends in Liverpool, where they've also now got a whole lot of allotments joined in as well. So it's becoming a farming city as well. Well, they're growing vegetables, which they're then provided through the food co-ops in that part of Liverpool. It's absolutely fantastic what's been achieved, and the way it's improved the mental health of people that are involved, because never underestimate the mental health crisis that we're in is not just a medical, in the sense of medical textbook crisis. It's a crisis brought about by stress over job, money, housing, children, care for elderly people and so on, and for middle-aged people, something they never thought they'd ever get into, which is massive debt. Most middle-aged people sort of think, well, you know, we're in our sort of mid-40s, 50s, kids are off our hands, we've now got a bit of time for ourselves, we can take holidays and so on. No, they've got kids with £50,000 worth of debt each if they've been to university in England, and they've got parents who are probably in need of social care, and they've got to pay a contribution, if not the whole bill, for that. And so they end up remortgaging their property, and the stress levels that comes from all of that, that's if they own a property, leads to this mental health crisis we've got. We're not going to solve the mental health crisis by giving people medicines. We're going to solve it by creating a less stressful society.
Well, thank you all for coming, and do check out Unite's Environmental Charter, the petitions on your nhsneedsyou.com about the NHS campaign, and also the rest of the events this week in Webster's Theatre that Peace and Justice and Jeremy are hosting. But thanks everyone for coming.
Thank you, Unite.